Hyperbaric oxygen has been around for a long time. It was first formulated basically in the early 20th century, even late 19th century for that matter. It was initially thought of as being most useful for people who have pressure-related sicknesses like decompression illness if they've been underwater and come up too quickly. So we think of scuba divers now, but back in the time before there was scuba diving, there were still a lot of people who were doing work actually underwater. And when they came up too quickly, they got really sick and some of them died. In fact, a lot of them died. What hyperbaric oxygen does in that setting is it helps the gas bubbles that have kind of escaped out because of the pressure changes from going underwater to the surface back into the blood, and so it doesn't obstruct all our blood vessels. That's sort of what decompression illness is. We can certainly do that, although I don't believe in our history of the hyperbaric chamber and the time that I've been here we've had to. But that is certainly something that we can take care of if a decompression illness patient came in. We tend to see a lot of patients with varying kinds of wounds. The most common kind of wounds that we see outside of diabetic ulcers is probably people who have had radiation for a cancer treatment at some point in their history. And the radiation damages the tissues in such a profound way that the very, very, very small blood vessels that really deliver the oxygenated blood cells to the tissues themselves are all damaged. Because the hyperbaric oxygen is able to inundate all of the tissues with that level of oxygen, we can get those wounds to heal as well. We do see some folks who have had breast or other sort of flap surgery from plastic surgeons, where the flaps are getting a little ischemic or not getting enough blood flow, and it helps those flaps as well and saves those flaps. So folks with complex breast reconstruction after breast cancer surgery, for instance, can really benefit if their reconstruction is looking like it's not getting enough oxygen and blood flow.